A 42-year-old woman presents with a 9-month history of progressively worsening fatigue, dry eyes, and dry mouth. She reports pain in her wrists and fingers but denies any significant swelling. She also complains of muscle weakness, particularly after spending time in the sun, and has developed a new erythematous rash on her face and chest that worsens with sunlight exposure. On examination, she has bilateral parotid gland enlargement, and her tear production is decreased. Laboratory results include ANA, positive, 1:320. Anti-Rho/SSA antibodies, positive. CK, 1000 U/L, normal, 26 to 192 U/L. Aldolase, elevated. Urinalysis, no proteinuria. What is the most likely diagnosis? A. Systemic lupus erythematosus, SLE. B. Sjögren syndrome with myositis. C. Polymyositis. D. Mixed connective tissue disease, MCTD. E. Dermatomyositis. Please pause and write your answer in comments. Now let's find the correct answer. Explanation. This patient presents with sicca symptoms, dry eyes, dry mouth, typical of Sjögren syndrome, along with positive anti-Rho/SSA antibodies. However, the presence of muscle weakness and elevated CK and aldolase suggests coexisting myositis, a complication that can occur in patients with Sjögren syndrome. This overlap of features makes Sjögren syndrome with myositis, option B, the most likely diagnosis. It is crucial to differentiate this from systemic lupus erythematosus, SLE, which also presents with photosensitive rash, but the muscle involvement and elevated muscle enzymes favor Sjögren syndrome with myositis. A. Systemic lupus erythematosus, SLE. The rash and positive ANA could suggest SLE, but the absence of systemic features like nephritis or hematologic abnormalities, along with the presence of muscle involvement, favors Sjögren syndrome with myositis. C. Polymyositis would cause muscle weakness but lacks the sicca symptoms and parotid gland enlargement seen in Sjögren syndrome. D. Mixed connective tissue disease, MCTD, can present with features of multiple autoimmune conditions but usually includes features of lupus, scleroderma, and myositis. The absence of Raynaud phenomenon or sclerodactyly makes MCTD less likely. E. Dermatomyositis, muscle weakness and rash can be seen, but the heliotrope rash and Gottron's papules typical of dermatomyositis are absent. Key takeaway: Sjögren syndrome can be complicated by myositis, presenting with muscle weakness, elevated CK, and classic sicca symptoms. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.